Can you hear us?
Oh,
All right.
Check.
hello.
Okay.
All right.
Thank you to our attendees online. This is Robert. If you can hear us in the chat, if you could just put a yes for Y or yes in the chat, we appreciate it. Okay, perfect. Thank you. Um, so it looks like we'll start with the chat. So in the chat, it looks like we have, and forgive me if I mispronounce it, is it Kara or Kara Erickson?
It's Kara, that's correct.
Kara, thank you. Thank you so much. We also have Robert Ewing.
Yes.
Okay, thank you. Martin Cunningham. And then also I saw, I don't know if she's still on, Callie McLaughlin. Oh, she's still connecting to audio. Okay, perfect. And then in the room, if I could have you go around and introduce yourself.
All right. My name is Molly Gottabed. I am a program director at the Community Health Council of Wyandotte County.
Kim Weaver, she, her pronouns. I am a citizen, community member.
Ross Stewart. I'm an attorney in the legal department at the Unified Government.
Okay, great. Thank you. Thank you. So all accounted, we have 8 attendees so far. So that's great. All right. So we'll go ahead and get started. Again, thank you all for taking time out of your evening to be here. My name is Robert Gibson. I am the chair for this task force, and this task force is the Community Health, Wellness, and Recreation Task Force. We are gathered today to continue the work of amplifying local initiatives in the community that are existing within this space, within this realm, and coming up with ideas for policies and recommendations that we can present to our elected officials that can strengthen this work and advance it forward and make it sustainable ultimately in our community. So that is a brief overview of why we're here, what this task force is all about. What we're going to do right now is we're going to start with the charter. So also I want to give a thanks again to Brian Perez. He is in AmeriCorps Vista with the mayor's office. Brian is assisting with all the task force, and I appreciate all his efforts and support. So we're going to bring up the current charter for the task force. In April, we looked at the previous version of this task force, and with input from a lot of the same folks who are on this call now, we made some edits and suggestions. And so we thought it best to hold off on voting on the current iteration of the charter after the edits until we had more folks in the room. And so today, I believe, since we have a number of folks here, that I think we can move forward with confirming the charter and moving forward from there. So what I'll do is I'll ask Brian. Brian has it up on the screen. It was also sent out in the email that I sent out to everyone. So either you can pull up that email or you can look at it on the screen, and Brian will slowly kind of scroll down.
Can they see it? Can everybody see it online?
Yep.
Okay, great. Thank you. And if there's anything that pops out, jumps out at you, that you want us to change or to discuss, we can do that. We'll allow, a period of time, a short period of time for discussion, but we'll take some time now to read the charter as it is. And then if all hearts and minds are in agreement, we'll vote on it and to put it into standing order. So.
All right, so I think we had one other person join, Alma from CHC. Well, otherwise we can just go ahead and move forward if we need to.
Alma, can we ask you to say hi, unmute and say hello so we know who you are? Or if not, that's okay too.
Yeah, you can just comment in the chat if you want as well. No worries. Whenever you're able.
I do have a couple questions.
Okay.
So at the very beginning of this, it mentions that COVID-19 and the impact of the pandemic has disproportionately impacted our local community. Are we still going to highlight COVID-19 and the impact, or are we going to transition from that since technically the pandemic is over?
That is a great point. And I don't think we caught that last time. So the suggestion to remove the COVID-19, the second sentence under the design, is there a second for that?
Second.
Okay, great, thank you. So Brian, if you could strike that sentence out. Uh, okay. All right. Thank you, Kim. Anyone else have any edits or comments? And highlighted in yellow was a sentence we added last time. So that was something else that was added.
I think you need to clarify, since you removed that COVID-19 out, the second sentence doesn't, it's kind of hanging there. It's kind of says these can only be eliminated if there's high quality information, but you don't have any, how did you know? I mean, I think you just need a clarifier there, because it's like you kind of just jump from one point to the next point, and it's like, wait, how do we know we have these things, and how do we know that we want to eliminate them? Does that make sense?
Yes, it does. That's a great point. Is that Callie or is that Cara?
Cara?
Cara. Thank you, Cara. Yes, that's a great point. Any suggestions on wording for the second sentence? Like, I actually think the first part, for example, is still okay, where it says racial and ethnic health disparities and inequities can only be eliminated if there is. Now, what do we want to say there is?
I don't know if you want to just say as a result of the, what we learned from the COVID pandemic. We noted that there are racial and ethnic health disparities and inequities, and these can only be eliminated. I mean, it just gives you a little background so that you don't just think, oh, we just pulled this out of the clear blue sky.
Yeah, I agree. I understand where you're coming from. I think the point and the ethnic and racial health disparities existed before COVID. They just got
Right.
highlighted during COVID.
Right.
So we may not necessarily even need to reference COVID anymore.
No,
Does that make
but I
does that make
mean,
sense, Car?
yeah, you can just say, we have identified that racial and ethnic health disparities and inequities exist, and they can only be eliminated if.
Okay.
That works for me. I honestly didn't anticipate you just striking that whole part out. I just wanted to bring it to everyone's attention that it may not seem relevant to the community.
No, it was a great point, Kim. And yeah, I didn't think it needed to be there, and I didn't hear anyone else disagree with that. So yeah, not a problem. Um, so to Car's suggestion, can you repeat that one more time, Car, so we can type that in? And Brian, when you type it in, do it as, can you track changes at the top under review? Yeah, that way we don't delete anything else until we can kind of see. Yep. Okay. And so yeah, Carter, if you don't mind repeating what you said,
The
please.
way, if I remember what I said, I think if you just say take the racial and ethnic health disparities and inequities have been identified, and these can only be eliminated. We just put that little tiny clarifying in there, that we have identified them and they can only be eliminated.
Just for the time being, if we could just put it there and we can see how it reads. So I think she was saying before the racial and ethnic health disparities we have
No,
identified.
Yeah,
Or
if you
after?
actually just leave it, if you just leave it, racial and ethnic health disparities and inequities have been identified.
Got it. Hmm.
And they.
Okay.
Yeah,
Okay. That still is a very long sentence. We might have to come back to that. That's a very long sentence. My English teacher would be shaking her head right now.
yeah.
Yeah, that's fine. All right. We'll come back to that. Anyone else? Any other areas or paragraphs that caught your attention, need to be changed, edited, et cetera, et cetera?
This is Martin. Are we going to try and integrate as quickly as we can all the efforts that have been going forward with the community health assessment and the health plan from the health department? I can see just from the first few paragraphs here that there's going to be quite a bit of redundancy otherwise.
Yes, that's a great point, Martin. I think I would like to add, as I mentioned earlier, the purpose is to bring forward. So it is in the purpose. I think we talk about recommendations, policies, and ordinances. And again, some of this will be overlap, like you mentioned, because we will amplify the, existing community efforts such as the CHIP, such as the heat cab, health equity task force, that's through the UG Public Health Department, et cetera, et cetera. So we will amplify. The goal is to amplify those efforts and utilize this task force again to bring forth recommendations that can strengthen, assist, um, have a positive impact on those efforts to make them sustainable and to bring forth to assist in the change that those efforts are seeking to make in our community. So I do think there still will be some overlap, and I thank you for pointing that out. But is there any language that you think should be removed or changed as a result of that?
No, I think it's fine for our second, the second time going through it. Yeah, let's leave it as it is.
I appreciate that. And yeah, I know a lot of us have we've worked our jobs today and other things. So we're kind of running on fumes. So we might need to look at this, in our own time a little bit. If we all get some time later, you can look at this again. But if there's anything glaring that jumps out, like for example, I see under leadership committees it's repeated twice. You see that, Brian? So we can remove that. So anything like that, if there's anything glaring that's sticking out, we can,
This is Molly,
that.
and in the design, on the last sentence, this committee is to explore all aspects of health. Hold on, you moved it. Go up. Improvement to include mental health and addiction wellness. Is wellness included in addiction wellness, or is that wellness separate? Like, is that,
That's a great
there
point.
be a comma after addiction?
So how's this sound, Molly? This committee is to explore all aspects of health improvement, including, not to include, but including mental or behavioral health and substance abuse, access to care and medical healthcare services.
Mhm.
Right. So like, instead of saying mental, you say behavioral health, I think is the more
Behavioral
accepted
health,
term,
yeah. I would say behavioral health.
and substance abuse.
No, because that's encompassed, I believe, with behavioral health,
Okay.
I would say. And are we going to also, I mean, I know that this is kind of like picking at it, but are we going to be talking about prevention too? Some of the things we do in general are prevention, so we're going to be promoting. So I feel like,
Yeah, we can add that. We can add whatever would make it as clear as possible what we're focusing on. So I think, Brian, we're not going to do substance abuse. I'm okay with it. Do other people have a feeling about substance abuse? If that, I'm not necessarily an expert in behavioral health, but does anyone that works in that field or know folks that do you know if they generally consider substance abuse as a part of mental health, behavioral health, or is it okay to just put behavioral health?
From my experience, they tend to separate it, or at least include both aspects of it. Substance use, and mental health. You know, that's what SAMHSA does, for example.
Okay, thank you, Martin. So you're in support of what Molly was saying, that behavioral health would be all encompassing. Is that correct?
Here right now, sure, sounds great.
Not
Okay, thank you.
necessarily, because mental health is, it's a fine line, because addiction is also considered a medical diagnosis. It's an actual disease identified. So
Mhm.
it doesn't specifically come under the mental health category.
Yeah, that's a good point, Cara. Molly, would you be okay with us just leaving, putting both like
Yeah.
behavioral health and
Well,
substance
and the
abuse?
only reason why I said that was because then you also would, like tobacco cessation and things would, I feel like, fall under behavioral health, and then gambling and other things. So, I mean, you could say mental health, behavioral health, and substance use.
Yeah, we can just do all of it. I think the goal is we want to catch everything. So we can put mental health, Brian, behavioral health, substance abuse. So
Robert,
you
to
don't
go off
mind.
your comment, instead of trying to include everything, why don't we just stop at health improvement and not try and get down into the
I think
including
that's a
all the,
wonderful idea. I
Yeah.
love that.
No, Brian, don't take off
Yes.
everything. Just instead of doing it says, so I think what Martin is saying, and Martin, correct me if I'm wrong, this committee is to explore all aspects of health improvement to
Yes.
including access to care and mental health care services. Is that what you're saying?
no, I was actually saying just to put a period after the end of health improvement, just leave it as general as possible. Because if we start including one thing, as was said, we're gonna have to include tobacco cessation and all the other components, which is gonna make it an extremely long sentence. But if we keep it generalized and just say health improvement, then it's all inclusive.
Okay, understood. That works.
Mhm.
Anyone second that?
Second.
Okay, thank you, Molly. Still seems like the phrase, like maybe we need to add something to the beginning, like to this end, this committee will explore all aspects of health improvement. I don't know. It just seems like a phrase, not a sentence right now, to say this committee is to explore all aspects of health improvement. No.
Well, I would just say that health in general can be encompassing of a lot of different stuff. So things they're doing with maybe different task forces, business economics, some things that are going on with
Mhm.
transportation, funding, grants. Like I think it works just as is.
Yeah, we'll just leave. You're right. Let's just leave it as is so we can keep moving forward. Okay. Again, I appreciate you all working through this process. We'll take about another 5 minutes to talk about any more edits or suggestions, glaring like edits, suggestions for the charter.
Robert, would it help at all to have the document available to everybody who's on this task force and do just track changes and sort of as we go vote on it or make side comments, yay or nay? Or is that
Sure.
just too unwieldy?
Um,
I'm actually really glad you brought that up, Martin, because as you go further down into membership, it talks about voting members. How do you decide who's a voting member?
It's a good point. Um, hmm. Well,
I think when these first came out, it was just kind of a guideline as to giving us some guardrails moving forward with the task force.
mhm.
Ultimately, it's just going to be kind of a working session with anybody who wants to be involved in order to have some kind of consensus. There will be like a majority vote from people who are, actually coming to these meetings. Getting people to come too has been an issue from the beginning. Making sure that we're just kind of being efficient and productive at the same time. So membership is anybody who will want to be included. There's no particular guidelines that we would need for it, to be honest.
So my only concerns about that is if I know that you're gonna vote on something and I don't agree with it, and your terms are that loose, I'm gonna bring a group of people with me to vote it down.
Yeah. And I think that's one of the things, because I'm sure all of us on this on that are here are part of some task force or groups or coalitions, but because this is through the UG and the government, we have to have some language around what constitutes membership. So to your point, Kim, that's a great point. And I almost feel like we should just take out membership at period, right? Like to not have a membership clause, but we kind of do need something, I think, because it is a unified government, house task force to signify what that actually looks like.
I absolutely think you should have a clause about membership. I'm not saying take it out. I'm saying you should clearly define what's membership and who is a voting member. And I'm not saying you have to do that tonight. I'm
Okay.
saying that really needs to be at the forefront of all of these things. So because as
Mhm.
you start to grow and you have more people come, you would want to have that defined.
Absolutely. Thank you for that clarification.
Right.
And I wasn't saying that's what you were saying, just to clarify. I was saying my preference is I would prefer just to take the whole thing out because if I had my way, it would just be anyone that wanted to attend would be able to give comment, whenever they attended or vote on whatever. But obviously, like I said, because this is a unified government house task force, we do need to specify that. Does
How
anyone
about
else
if
have
you
any
just,
comments oh, sorry.
yeah, apologize, I just jumped in there. On membership, if you just merely take out that word voting and just make that specific paragraph be about membership alone and later say something about voting if necessary, but it's fine otherwise, just to say that members may participate in the meetings, blah, blah, blah. It includes something like you just mentioned that you want anybody and everybody to be there. But they may not here necessarily be voting members, or just members. Maybe later say what constitutes a quorum or what constitutes a yay or a nay vote, etc.
Okay, I see what you're saying. So instead of saying voting members, you just saying voting in meetings electronically is an option if available, and participation meets requirement of the Open Public Meetings Act. So you're saying remove any language that like that basically state like that would lead someone to think that they need to be a certain status of a membership in order to vote, essentially, Mark.
Yeah, I agree with that.
Okay. So Brian, if you could strike out or where it says members to meetings, like from that part, from members to meetings, strike that part out. So it just says voting electronically, and then you could just put, yep. And then voting electronically is an option when available, and participation meets requirements of the Open Public Meetings Act. And instead of if, that option is an option. Yep.
So Robert, hi, this is Alma. So you're gonna remove voting members from the top? Sorry, Brian. Towards the top
So
where you were. Okay, the option when is available.
Yep. So
Okay.
voting electronically is an option when available, and participation meets requirements of the Open Public Meetings Act.
Okay, gotcha.
Does that sound clear to everyone? For now,
Yeah.
at least? Okay. And to Martin's point, what we'll talk about is I need to make sure I can do that. I will send this out and allow folks to offer comment, track changes with the hope that by the July meeting, we can have something final. Does that sound like a plan? Okay. What'd you say?
Take it offline, come back to that and get some clarification from the mayor.
Yep.
Last time I spoke with him, pretty much that's what he was saying.
Okay. All right. Thank you, everyone, for your comments. We'll stop with the charter for right now. And like Martin suggested, we'll get back about folks being able to offer comment and submit edits to a workable document that we can all have access to. All right, we'll move on now to the presentation for tonight. Okay. Thank you. All right. And so before we get into this, I just wanted to frame again why we're having this presentation being presented. Again, the goal of this group is to bring forth, again, efforts in the community that are coexisting or new, or thoughts of any members in the community that you would like to see happen, so that this task force and the members of the task force, or those who are present and willing to participate, can amplify that through offering advice, suggestions, edits, what have you. And then also it allows for the community to have access to this information, because some of this information may be new. Some people may not know about some of these efforts. So we want to accomplish those things first, and that's what we're doing today. And the next step is to then talk about ways that we can offer, again, recommendations, policies, or other suggestions to take these, efforts and to make them sustainable and actionable in our community. Whether that's, bring them to elected officials, whether that's collaboration between certain organizations, whether that's increasing support through community campaigns or events. We just want to be able to, again, make these efforts that we present here things that we can see change, that bring about change in our community. So this effort that we're highlighting today, the Medicaid re-enrollment efforts in Wyandotte County, are efforts that are ongoing currently and have been ongoing for about 6 months through the CHIP, which we talked about in April, through a task force that you're going to hear about, the Medicaid re-enrollment task force. And so this will serve, we're going to use this as an exercise. My thought was to use this as an exercise, not only to educate for those who are not aware of what's going on currently with Medicaid re-enrollment, but then also to talk and have some discussion at the end about current ideas that are in motion to make this effort something that can be supported and amplified in the community, and even be brought forth to our elected officials to be supported and increased in their efforts to make it more sustainable and to bring about, again, greater change in our community. So again, that's why we're focusing on Medicaid re-enrollment. I'm open, and at the end, I'll actually open it up for comment on other efforts that we can talk about or bring forward at the next meeting, that we can have the same discussion. And the goal would be every month to do that same exercise, to bring forth an initiative, an effort that we can talk about and have that same type of dialogue after we have a short presentation about it. Anyone have any questions? No? Okay. So we'll start. Oh, what happened to the okay. Yep. Okay. So Brian, do you mind pulling up that YouTube link? So a little levity. If you might have to get out of presentation mode and just copy the link. Yep. So this is a short video that was created by the task force, specifically from staff at the Community Health Council of Wyandotte County, that gives, it's for the public to highlight the issue of Medicaid unwinding or re-enrollments that is currently happening across the nation. You can just press play. Oh, sorry. Yeah, that one, the middle screen. Yep. Can everyone see this? Are you ready? Can everyone see this online?
Yes.
Yes.
Okay, great. You can skip the ad, Brian. Thank you. Yeah, we want to stop the Ocean Gate talk. That was a unfortunate situation. I'm sure everyone heard about that, but yeah, very unfortunate. So, all right. So just a brief overview for those who may not be familiar with what Medicaid is, Medicare. If we're going to talk about a task force, Medicaid unwinding, making sure we understand exactly what we're discussing. So Medicare is a federal health insurance program for anyone age 65 and older, and some people under 65 with certain disabilities or conditions. So the main thing is Medicare is a federally operated program, whereas Medicaid is a joint program that is federally and state ran, and it gives health coverage to some people with limited income and resources. So main difference is Medicaid, state and federally ran and operated, and mostly based on income, whereas Medicare is a federally operated program and is mostly based on age. Again, for those who are over 65, and in some cases, those who are under 65 with certain disabilities or conditions like SSI, et cetera, et cetera. All right, I got next slide. And so Molly Godabed is here with me, as you heard earlier from the Community Health Council, and she's gonna assist me with the presentation. Molly?
Yeah, absolutely. Okay, so like the lovely video said, so for the last 2 years, folks who had Medicaid because of COVID-19 were not required to renew their coverage to stay eligible. Typically, most populations have to send in renewal paperwork every year, some of them passively through just like, yes, everything is the same, some of them through a full application. But during COVID-19, because of the public health emergency, all of that was stopped. So everyone got to keep their can care, even if they were no longer eligible for it. So the unwinding is the general term that the federal government made for redetermining people's eligibility when they hadn't had to do so. So this actually started in February for Kansas, they started. We thought they were going to start in February, but then they started getting letters and everything started happening in April. Missouri is a month behind us. This has been. Oh, I'm not even looking at the slide. I'm not following the points. Okay, so but in Kansas, our Medicaid system is called CanCare. We've got about 22% of Wyandotte County residents are on Medicaid. We do have some of the worst health outcomes in the state of Kansas. We're at about 100. We're ranked the worst out of 104 counties. And so of the 22% of our county, we have a lot of folks who are still uninsured. And I'm sure you guys know about the Medicaid gap, but if you don't, part of the Affordable Care Act initially was that if you're, each state was supposed to expand Medicaid eligibility to their citizens. And then like up to a certain income level, which is 138% of the federal poverty level. And then everyone above that, if they didn't have access to coverage, they could get marketplace insurance. Because as you probably know, Kansas has some of the most strict regulations around who qualifies for Medicaid. So it would have loosened those up and given more people access to Medicaid coverage. So that's what we refer to as like the ABODs, the able-bodied adults. Without children. So in Kansas, you basically have to be a child, a pregnant person, or someone with disabilities, or even like a caregiver. Caregiver income, I say lightly because the income guidelines are still incredibly low. So an adult without children in Kansas basically can't get Medicaid, even if they have a lot of illnesses. They have to be considered disabled by the federal government receiving SSDI. And then again, like with the caregivers, it's about like $600 per month of income that you can have or less. So basically you have to have no income to be an adult with a child or a guardian. So we know that some of the folks who had their Medicaid during the pandemic only qualified because of certain situations, like their children were younger or they were pregnant, and then they got to keep that during the pandemic and were booted off recently and will continue to be throughout the rest of the year. However, we know that a good chunk of those people who are being kicked off of their Medicaid right now are still eligible. But if they don't tell the state that they're still eligible, then they won't know and they will get booted off. So what we're doing as a community with one of the CHIP teams that Robert leads is we are trying to get the word out to the residents about this process, and they already know because they've either a good chunk of them have lost their Medicaid and they figured that out when they were at the doctor's office and were told they no longer have coverage, or they got weird letters in the mail stating that their coverage is going to end by the end of the month. And we work with state partners to learned about the different developments with the state and everything as things get phased out. People are being getting these renewals within phases. So it's all based on when they initially signed up for coverage. And initially, when they got their letters, they had a date by when they had to have it returned. And if they didn't have it turned back in by the end of the month, then they would be, or by, well, it was the 15th of the month, then at the end of the month, they would automatically lose their coverage. However, they would have a 90-day window where they could come back and sign up and their coverage would be made retroactive to the day that they lost coverage. And so that happened in April. Oh my gosh. So sorry, Robert, had a whole presentation. I just started talking and it went out the window. Yeah. So I told you I was going to fly off the cuff with this because this is just what I talk about. So now the thing is trying to get people to not lose their coverage. So we had a lot of people kicked off in the beginning because the way that the state was doing it was, I don't know, not the best, whatever. They had a lot of people get booted off that maybe shouldn't have been booted off. It caused a lot of issues. So they've come back and changed some things. They're giving people a little bit more space. But the basics of this campaign is that we want everyone who has Medicaid, who hasn't done so yet, to make sure that first they're updating their address and contact information with the state of Kansas so they can get those renewal packets. And then once they get the renewal packets, that they're turning them back in, and doing that in a timely manner and not waiting till the last minute, because they may need to verify information or different things. And if they don't do this, then they very well could lose their coverage. And you can get it reinstated, but it takes some time. And of course, as you can imagine, the state Medicaid office is pretty overwhelmed. And if you lose it, then it's going to take that much longer to get it back. And you can, like I said, get it made retroactive, but your providers might not be willing to see you. And it just is an added stress that our community doesn't need. And so we're really trying to work with the different organizations in the county who do this work, like signing people up for Medicaid and helping people with applications, and the different healthcare facilities who actually have Medicaid patients, because they're advocating for these policies too. So anything we can do to reach people, to let them know that this is what's going on, and if you need help, please contact us, because it can be a pretty complex system, and we are well aware of the barriers. And for that reason, the different managed care organizations have leaned heavily on the community-based organizations to help relieve some of the stress caused by this, so we can provide assistance where maybe the state can't, because we can actually help people with applications, and there's just a lot of things going on. So
Thank you, Molly, for that overview. And as she said, the whole purpose of why we're doing this is to make this an equitable and stress-free process, because as you heard, that was a lot of complexity, right? A lot of things that are going on that you have to be educated and knowledgeable about. And imagine if you get a letter in the mail, or you go to the doctor's office, like she said, and you realize you don't have coverage. For a lot of our residents and community members, they may not know the first place to start. They may feel overwhelming, in addition to the other responsibilities they have with their job and their children, and et cetera, et cetera. So this task force is not only about advocating for this process, bringing the information back to our state, because again, Medicaid is a state and federally run program, but also getting the information out to make it as stress-free and as equitable as possible for our community members. So Molly gave a lot of great information. I'm just going to quickly highlight a couple of the things she said, and then we'll get into a discussion about how we can support this effort and bring some recommendations and things that we're already actively doing to bring recommendations to our elected officials. And so, as Molly said, I talked about in April, the CHIP. If you remember, this is the structure of the CHIP. It's led by the health department, as you see in blue in the middle. So you can see that right here. The health department is the backbone agency. There's a steering committee with different organizations in the community that are represented. So like the lead agencies here, each have a representative on the steering committee. I represent Vibrant Health on the steering committee, for example. And then each of these lead agencies lead a prioritization area that was identified in 2017 during the community health assessment that was done at that time, to inform what issues we're focused on in the current CHIP that will actually be ending at the end of this year in 2023. And coincidentally, we're actually doing another community health assessment now while we're finishing up this current CHIP, to inform the efforts that we will focus on during next year, starting in 2024, for the next iteration of the CHIP. And so if you're interested and you would like to be a part of giving your feedback, if you haven't already done so, there's a survey that the public health department has created for input on prioritization strategies for the next CHIP. And we will be happy to send that out to the entire task force so that we can get as much input as possible from everyone in the community. Yeah, they're going to present it once it's finished, so that everyone can see. And they're actually going to have sessions. The question was, will we get the results? Will the community see the results? And yes, they will be the results will be made available and distributed. And actually, last month they actually had an initial session where they discussed the current information they received from the community through surveys and discussions and forums in the community over the last year around issues that the community will like us to focus on in the next CHIP. So now the survey is taking all of those issues that were presented and kind of whittling them down to the top issues that we can focus on, because we can't focus on every issue. We don't have the capacity and bandwidth, but those that are a capacity, I'm sorry, a priority based on the community input from the survey, those will be the ones that get focused on, like with these areas here. If you see, again, community healthcare access, jobs and education, violence prevention, and then safe and affordable housing. All right, so focusing on healthcare access, again, just to give you we went from a top-down view with the CHIP, then you saw Vibrant Health leading the healthcare access portion. The work of the task force falls under the healthcare funding strategy for the CHIP of their healthcare access. And if you look here, you see expanding CanCare and Medicaid, and also coordinating improving efforts to increase community member enrollment in Medicaid and marketplace health insurance plans. And I want to give a big shout out again to Molly and her team with the Kansas Assistance Network that is housed under the Community Health Council of Wyandotte County for all their efforts to help increase community member enrollment, like she mentioned, specifically over the last couple of years with the pandemic. But now with this unwinding happening, we felt it was necessary and important that we create a task force housed under this section of the CHIP to address what is currently going on, so that we don't go backwards, but we can go forwards. And we can continue to move forward with our efforts to provide as many residents as we can with access to healthcare. All right, and so as I mentioned, this task force again was created under the healthcare funding section of the healthcare access portion of the CHIP. So I don't have to really go over that again. It's a joint effort between many organizations such as Vibrant Health, Community Health Council, El Centro, just to name a few. And also the UG Public Health Department, again, serving as a backbone and support. Molly already kind of touched on this. So the first renewal started in April, and then this gives you a visual of what she was saying with the timeline. So if you look, like she said, around the 15th of every month, letters go out to a new batch of current Medicaid recipients. It is random at best, decided by the state. They have their algorithm and how they kind of send these letters out. I think it's mainly determined by when these the recipients of Medicaid, the Medicaid recipients enrolled about 3 years ago. Is that correct? So whenever they enrolled last, when they had to do this renewal process, which would have been in 2019, whatever month they enrolled, that is the month that they're trying to send the letters out. Again, it's not a hard and fast rule, but that's what they're trying to follow in sending these letters out based on 3 years ago, or 4 years ago at this point, 2019, when those members originally signed up and got re-enrolled. And again, this is a 12-month process. So they're doing this every month for the next 12 months, and they'll go until February of next year of 2024. And so this is, again, a more zoomed in version of what Molly was saying. So if they send the notice out between the 1st and the 15th, let's say in this example, you get it on the 17th, they'll have until the end of that month to get the letter back. There's been their application back, excuse me. There's been some changes since then where now they're giving a grace period. So let's say, for example, in April, there was a letter sent out between the 1st and the 15th or 17th. Instead of it being that you lose coverage at the end of the month if you don't get the application in, they've actually been giving members another 30 days. So until the end of the following month, in this case, it would be May in this example, to get their application submitted. So they would still be able to maintain benefits within that 30-day kind of grace period. But that's a recent change. That wasn't how it was when they first rolled this out. So just shows you, again, some of the complexities with this process and why there's a need for getting this information out to the community. All right, and so this is more technical details about when members will receive the packets and the renewal dates, some of which we already covered. But again, it's important. This just highlights why we need to make sure folks know about this, because if they've moved, I mean, I'm sure, you know, in the last 4 years, just in this task force, how many life changes folks have had, you know, whether you've gotten married or moved or had kids, or moves houses. I'm sure some people may have moved twice, you know, in the last 4 years, for different reasons. If you moved and the state doesn't have your updated address, then they can't get that letter to you. And then you can't get the renewal application, and then you can't maintain your benefits. So this information just again highlights why it's so important that we have been getting the word out to our community so they can get access to the information so they can turn in their application. This is the website where folks can go, current recipients can go to look up their account. So this is just for informational purposes. And again, thank you to United Healthcare of Kansas for these slides. Our colleague on the task force with United Healthcare has been generous enough to provide us with consistent information. And so we appreciate United Healthcare of Kansas and their support of the task force and Wyandotte County residents with this process. Again, in the video that you saw, these are the numbers that were shown for contacting the direct MCO. So in Kansas, our Medicaid is called CanCare. Each state, again, has a different process, like Molly said, where they determine what insurance companies are involved with giving coverage to their Medicaid recipients. In Kansas, we have 3 health insurance companies. We call them MCOs, managed care organizations, that provide Medicaid benefits. Those 3 organizations are United Healthcare, Sunflower, and Aetna. But different states have different agreements with different insurance companies. They also have different statutes and regulations in terms, like Molly said, of the qualifications for Medicaid based on your income level as pertains to the percent below the poverty level on the federal level. So in Kansas, I believe it's 38% or 37%, whereas in some states it could be, you know, higher. It could be 45%. And again, the higher the number, the more folks that can get access to Medicaid. The lower the number, then it's more strict in terms of what your income has to be in order to qualify. So in Kansas, as Molly said, we have some of the strictest, the most strict, I should say, Medicaid requirements in the country. And this just gives an idea of the website, where folks can go to update their address and make sure that they're to be able to get their letter from the state so they can re-enroll. These are just going over again the different options available, just more information on that, on how to update your address and reapply for Medicaid benefits. These are just, again, this is very important. Molly mentioned some local organizations that are involved in this effort. So Vibrant Health, we are available to our patients. Unfortunately, we're bound by our rules as a federally qualified healthcare center. We only can provide help to residents who are patients of Vibrant Health with this process. So those patients can contact our financial coordinator at the number and email listed on the screen. For those residents who are not Vibrant Health patients, like Molly's organization, the Kansas Assistance Network, that is affiliated with the Community Health Council, is available to offer services and support those who need assistance with this process. Also, El Centro, which is another local organization, is involved and willing to support patients with navigating this process. And then also for those who do not live in Wyandotte County or who are in need of additional services, they can also go to the Find a Navigator website that is governed or operated by Cover Kansas, and they can also find support through local organizations at that website. All right, again, just 3 takeaways again about updating your address, checking your mail, and getting the renewal completed. That's the biggest thing related to this process, is that folks need to get the information so then they can turn it back in, and then they can determine if they are eligible for renewal. And if they're not, then they need to get assistance with other options for maintaining medical insurance outside of Medicaid. This is an example, lastly, of what the packet looks like. Again, it's non-discrete, so if you're not looking out for it, community members may not know what this packet looks like. So this is just what it looks like. It's in a basic manila envelope. Just showing again that this process is not that clear. It's not as clear cut, and it definitely requires all of us to get the word out to our community members. All right, so that concludes the presentation. Thank you for sitting through that. The next step, and Brian, you can stop sharing the screen now, is we wanted to share like some next steps, what we're doing with this information and how we've already started to engage our elected officials with this process and supporting our community members in navigating this Medicaid unwinding process. And so we've reached out, we actually have, we had a panel discussion back at the end of May for our community, where Molly and other folks in the community answered more pointed questions about this process. And it was actually recorded, so we have that recording to share. And we actually had Commissioner Bynum attend, and she was very interested in trying to support these efforts, and she's attended these meetings as well in the past. And so we've had some conversations with her following that panel discussion around setting up monthly community events that would serve as a way for our community members to get access to this information on a grassroots level. So we would have like information sessions, we would provide potential childcare, have food, and do it in the evening so that it would be accessible again at times where community members may be off from work and available. And again, by providing childcare, you're eliminating that as a potential barrier for folks to attend, and also having food as well during, if this is during a dinner time event, that also would allow more people to come out. And so we've had some preliminary conversations around getting support from the commissioners to do this. But that is just an example of how we could do this with other things. So if there's other efforts in the community, we would talk about, strategize ways to amplify those efforts, give a bit of information, just like we did with Medicaid unwinding, and talk about what those current efforts are, figure out how we can get behind that effort, support it, and then connect those efforts to whether it's elected officials or other resources in our community to support those efforts, move them forward, and again, ultimately bring about actionable, sustainable change in our community. Commissioner Bonham could not be here tonight to talk more about those efforts, but they're ongoing conversations, and we hope to start these community sessions in July, and have them once a month at minimum in our community at different recreation centers, for example, based on zip codes. That was some of the things we talked about, based on the zip codes that have the highest percentage of Medicaid recipients in our neighborhood. So that way we're hitting the target areas for folks who really need this information. So with that, I would open it up for questions. Does anyone have any questions about what was presented or possible next steps for this task force in terms of efforts that we could amplify in our community?
This is Martin. Based on our population and the statistics of 75% of the folks within the state who are on can care, it roughs out to be about 28,000 need to renew on an annual basis. I'm making a wild ass guess here. How much of a problem do we have? Is this something where a whole lot of people are not renewing, and there's a really serious problem? There's tens of thousands of people who need help with this, or are we talking more like 4 digits?
So currently, in Wyandotte County, it's going to be tens of thousands, and it's already been thousands who have been dropped. So,
Got it. Thank you.
yeah, you're welcome.
Yeah, great question, Martin. And I would just add that the state actually had an estimated percentage of of how many people in the state they thought would be able to retain their benefits, and that number is actually decreased. Correct me if I'm wrong, Molly, I think they were looking at about 25% of folks that could be retained out of the 75% that you mentioned across the state, Martin, that had Medicaid benefits will be able to maintain their benefits as a part of this process. But they're now believing that number is actually going to be lower than what they anticipated. And again, the different factors, it could be economics, it could be household size has changed, a number of different things can impact that.
Got it. Thank
That's a
you.
good point. I'd like to clarify some things if I can, especially to your point, like you're saying, it could be housing, people changing addresses, things like that. I'm not necessarily an expert when it comes to health. Obviously, you guys are the subject matter experts. But I was thinking about it at the same time when it comes to the membership and the voting members, and with us not being public officials or elected officials in this capacity, if people do come and they vote us down on certain topics, I would just think that we're not educating them well enough, or we don't have the evidence-based resources in order to provide so that we can make a clear point. I'm not too familiar with the chip. So one thing I was doing, and I don't know if everybody can see this, I do want to share this real quick. So if you don't mind. So we don't have to reinvent the wheel. I think a lot of this work has already been done. One of the things is Kim has the heat report. I know you were talking about maybe getting that updated. A lot of the stuff was from 2019.
It should be updated by the end of this month, in theory.
Okay. And talking to you, Robert, one thing you were mentioning was the social disparities. So whenever I go to the website for the CHA, looking at the report, you can also find a lot of different links that take you to some of the determination factors. This website's pretty good too. One thing that I found in here was evidence-based research. And it gives a different type of evidence-based resources. When you dive into this, they already have some recommendations from community task force here currently, and you can look at all their findings, and it does kind of specify some specific needs. And then you can kind of narrow it down from there, some things that may affect us more here in Wyandotte County. It allows us to kind of go through. I think I left one for you as well. You can check it out. But some of the stuff I was looking at recently.
I appreciate that, Brian. If I can interject,
Yeah.
I think this data that you pulled, though, is it specific to Wyandotte County or is it just national data?
Now this is going to be national, so it
Okay.
came from this website.
Yeah. So,
Overall, but narrowing some of this stuff down, like I said, with you guys being the subject matter experts,
yep.
seeing if any of this stuff relates to what goes on in Wyandotte County, we can kind of keep.
And
it there.
I appreciate you bringing this resource. I think it, as you mentioned, though, there, like you said, there are, efforts ongoing. As I mentioned, the heat cab, the heat map report, health equity task force that are actually analyzing and collecting this data locally. And so this, the information you pulled up is helpful, but we have efforts here that are actually, showing what we already know. Essentially, they're giving the data to, prove what we already know about our health outcomes and the areas we need to focus on. And again, what I envision this task force doing is taking these things and getting behind them, again, amplifying them, moving them forward, and getting our government connected to these efforts. Because in a lot of cases, we have our community members who are doing these things, who are working on these efforts, but our government in the past may not have been as involved in some of these efforts and helping to move them forward. And so I know Mayor Garner created the task force to help align some of those efforts in some aspects. And so I'm fortunate enough to be a part of this effort, and that's what I would like to see us do with this effort. And again, with this task force. And again, I'm open to any suggestions anyone has on efforts that we could get behind, have come, in the future months, present on. For example, Kim, if the heat map will be available potentially by the end of this month, would that be something potentially we could look at analyzing and talking about at this task force next month?
I do want to say that we were told by the end of this month, but today is the 27th.
Okay.
So I don't know when we're gonna actually get it, but we were told by the end of this month.
No worries. I mean, we,
Yeah, I don't have a problem with us
Mhm,
and doing a quick presentation on it.
absolutely.
Say that the heat report itself is usually about an hour and a half presentation, which would take the whole time. So we would have to really condense it down to talking about just social determinants of health.
Mhm. Yeah, whatever you feel comfortable. I mean, I didn't mean to put you on the spot, but whatever efforts, that was just an example. I know, for example, racism as a community health crisis, that those efforts are actively being presented to the community on next steps, ways that we can support that. There's a safe streets initiative that has been going on, right, with the Healthy Communities Wyandotte. It started a long time ago that we could be potentially supporting about moving those efforts forward. So housing is a big issue in Wyandotte County, and how we can support the community land trust and other efforts in moving those things forward. So again, I don't want to keep talking, but I just want to hope this, the things I'm mentioning gets the wheels churning, and folks can type in the chat. You can feel to unmute yourselves. I'm open to hearing from you all about things that we could be supporting in our community that you may be a part of or know of, that I may not be aware of, that we can support.
And I appreciate that, because I think in Wyandotte County, a lot of times, because there's a lot of good work going on, and a lot of it is because of some of the work going on with the chip and the different things. And I think it's going to be really important to, like, align with those things, so we're not reinventing the wheel, but then also seeing the work that other folks are doing, and just seeing what's important to the community, and how we can make a voice to those and stop working in silos. Because if we were to come forward and have a whole new agenda, that just does not make sense. And I know with health insurance enrollment, especially like 9 years ago, one of the key factors in it being a success was that we had the mayor's support at the time. And so it was small organizations doing the work and doing all of these things, but then the mayor came forward and would hold events on it. And we got a lot of support from the commission, and it helps to have leverage in those conversations to get things moving.
I do have a question. Does everybody online know what Chip and Shaw are? We keep throwing these acronyms around, and I don't know if y'all even know what they are.
Yeah, that's a great question, Kim. I don't want to interject. Please tell me if you don't know, but we did have a presentation in April, the last time we met. I talked about the chip and the cha, and I gave an overview of both. But for those who may not have attended, please let me know if you need me to clarify, and I can provide you with that presentation that we did in April.
Yeah, I'm familiar with it.
Okay. Well, I appreciate everyone's time. I open it up for any final thoughts. To Molly's point, I will say, I believe this task force and the other task force that the Mayor Garner has created is an effort to do what Molly mentioned, to get the government supporting these initiatives that are existing in our community, to amplify those great efforts. And it's up to us to kind of take this opportunity, this vehicle that we have, and to, make the most of it. And so I appreciate, all of you for being here today. Please invite others that you think would like to be a part of these conversations. For next month, I'm going to continue to research another effort that we can present on. And again, it would be the meeting agenda would be, one, having a short overview presentation on the effort, to bring people up to speed about what the effort is. Two, to then have a discussion amongst ourselves around the effort, any questions, ways we can move it forward. And then three, kind of ending by talking about recommendations we could bring either to our elected officials, or ways we could work together, like Molly said, across cross collaboration between organizations to support these efforts and to really advance them forward and make them sustainable. And so I'm going to keep repeating that because I want to make sure that we are on the same page around what the vision is for this task force and what we are here to do. So if you feel like this is something, again, you want to participate in and get behind, I welcome your participation. I welcome your continued support and attendance at these meetings. And again, I ask that you invite others to be here. And because we can't do this work by ourselves. We need, many great minds and energy as we can to get this accomplished. So anyone else have any comments before I conclude the meeting? All right.
This
Well,
is-
thank you again. Yes.
Hey, sorry, Robert. This is Kara. I just wanted to say, I think you're spot on with that. Like all these little things that we have going on in the community where you can just give an overview so we can say, oh, hey, look what this, so that, like you said, we're not reinventing the wheel, but then how we can combine our efforts to include that in our task force or whatever we need to do. Because there's a lot of stuff this encompasses. And I think knowing what's already going on and how we can maybe add on to that or affect change in that is an awesome idea.
Thank you, Cara. I appreciate your comment. And I forgot to mention, one of the things I'm working on is try to get this, made public on Channel 2. I know we have a closed, like we use for the commission meeting, so that we can get this information out to the community. So for those who can attend, they can watch what we're talking about, get the information about Medicaid or, the different things we're going to talk about. So that information is readily available in real time. And then also inviting other commissioners and other elected officials or representatives to these meetings. Like we're grateful to have Commissioner Bynum support. If there's a commissioner that has a specific interest in something that we're going to talk about, we can invite them. Again, it's to bring community in connection with our elected officials so we can continue to talk about these issues and amplify them moving forward in an open public fashion. So collectively, that's the goal.
We'll say that these meetings are open to the public, that it's announced on the UG's website, so anybody can join in, and then they go to the UG TV as well. So they'll be on YouTube, so anybody can watch them at any point.
Excellent. Thank you, Brian. Was there a comment in the chat? I think someone. Oh, great. Yep. And I'm open to other suggestions. If I had my way, we could do this with childcare so people could come and all of that, but maybe a little lofty for now, but maybe in the future we could do something like that as well. So, all right. If there's no other comments, we will conclude the meeting at 7:24 p.m. Thank you all for your time. Have a great rest of your day and even better into your week. Thank you.